Dr. Ed Keystone, no stranger to this meeting, is our first speaker. He's professor of medicine at the University of Toronto, and he's the director of the Rebecca MacDonald Center for Arthritis and Autoimmune Disease and chairman of the Canadian Rheumatology Research Consortium. I Googled Ed's name, and he came out as the #1 rheumatologist in Canada. He received his MD at the University of Toronto, and he did his residency at the University of Michigan, and he's the founder of the Arthritis and Autoimmunity Research Center. He's founder and chairman of the Canadian Rheumatology Research Consortium. He's recipient of the Grand Master Award of the ACR, and of course one of his largest awards was the 2011 Congress of Clinical Rheumatology Outstanding Speaker Award. And this morning, Ed's going to talk about emerging treatments of rheumatoid arthritis.
First of all, I just want to say I'm privileged and pleased to be back again here, particularly in the warmth, given the fact that in February, there wasn't one day in February that was above 32 degrees. It was a little cool. And we had some snow last week. So when I say I'm glad to be here, I'm glad to be anywhere south. I'm pleased to be here, and I want to thank the organization for inviting me once again. So, what am I going to talk about? Well, we're going to talk about new therapies. These are my disclosures. Now you see them, now you don't. So, objectives. What am I going to do? There are three main objectives. Number one, we're going to talk about the targets, the new and older targets in rheumatoid arthritis. Number two, we're going to talk about the rationale for inhibiting cytokines, for example, the strategies to inhibit it. And finally, I'm going to talk about the efficacy of the new molecules, both antibodies and small molecules. So that's what I'm going to do. And the next slide gives you a sense for the, shall we say, the targets and the novel therapies. So what you can see here is we have the novel cytokine. I say novel, but IL-6 is not a novel cytokine, although it's an IL-6 and an IL-6 receptor, two different types of therapies. So IL-6, IL-17, for example, and GM-CSF, which is granulocyte macrophage colony stimulating factor. In addition to that, we're going to talk about a novel, and I must say I think it's pretty novel, a novel hybrid molecule, which binds both IL-17 and a TNF inhibitor. Very cute. And then I'm going to chat about some of the small molecules, JAK1/3, JAK1/2, JAK3, and recently I'm going to now talk about JAK1 as well. Now it seems like a long lecture, it is, but I talk quickly. They call me Fast Eddie, so I think we'll be able to get through this. So here's the key point, and this is the thing. To translate research findings from the bench to the bedside, you need to understand the pathogenesis of rheumatoid arthritis or any disease. Very simple. So, what's the classic pathogenic scheme in rheumatoid arthritis? So the next slide shows that. And this is rather complex, and I'm a simple country Canadian rheumatologist who doesn't, get it when there's just too much stuff on a slide. So I decided I'd make my own schema. It's dated, but it still gives you the sense for what's happening. So what's my slide? There it is. Very simple. See, at the top you have a blood vessel. Cells go flying by the joint. Then they adhere to the surface. They get sucked in. Then chemokines basically bring them in, and then they're activated. You can see here that a T cell activates a B cell. A T cell activates a macrophage. The macrophage T cell, B cell communication produce antibodies, but also produces cytokines. The cytokines then cause T cells to interact with synoviocytes, which you see here. Hold on, I want to figure out how to do that. Yeah, that's not fair. I'll do that side, then I got to do that. Very confusing. So they interact with the T cell, the synoviocyte. Obviously, further cytokines are released, and then destruction occurs. So what are the targets? And these are the usual kind of targets. Nothing exciting, nothing that much new, but there are some targets here. Targets. Press. Presto. I'm pressing. So what are the targets? Obviously, the adhesion molecules, because that's bringing the cells into the joint. They attach to the inner surface of the cell, and then they come in. Chemokines, which also are chemoattractants, they attract the cells into the joints. And then, of course, when the cells interact, you have a target, which is the T cell.